Hi, everyone. Welcome to the SIR Medical Student Council Annual Business Meeting. My name is Rayan Abboud, the incoming chair for the Medical Student Council, it's MSC for short. Today, I'd like for us to discuss this past year's accomplishments and our future directions. We hope that this meeting will serve as an introductory session to all things MSC while showcasing our work and also helping get any interested students involved. Thank you all for joining. Let's begin. So for our agenda, in a minute, we will start with introductions, and then we will briefly cover the organizational structure of the Medical Student Council. We will then briefly cover the initiatives and achievements of each committee. So every committee chair will discuss their committee's goals and past accomplishments. And this part is particularly important for those students that are interested in applying to a certain committee. And lastly, we will discuss the application process and offer some of our advice regarding applying. Time willing, we will field any relevant questions from the audience. If you do not get to your question, please feel free to reach out via email, which we will have attached at the bottom slide. So for our webinar rules today, if you are in attendance, you have been muted, and you may ask questions in the chat box. Specifically, you can address that question to SIR staff. If you don't, it will send that question to the entire attendees list. And everything that is discussed during this webinar will be recorded. The webinar will be edited, removing any extraneous parts that may be irrelevant to our focus. And lastly, I'd like to thank you all in advance for your cooperation. The official mission statement of the Medical Student Council is shown here. Our goal is to promote the practice of interventional radiology to students passionate about the future of IR. It is all of our mission, with your help, to further propel IR to the forefront of clinical medicine and patient care by providing the resources and community that will help cultivate and foster the most passionate and brightest minds to gather to our specialty, while also aiding them in their training. To give a brief history of the Medical Student Council, the idea for the resident, fellow, and student section, which is RFS for short, of the SIR, which is currently the parent organization of the MSC, first started at the SIR annual meeting back in 2009. That year, Dr. Vaticancheri from Kaiser Permanente in LA met with a number of passionate residents who were interested in expanding the clinical aspects of IR. And they then formed what is now known as the RFS, the Resident and Fellow and Student Section. The MSC later grew out of the RFS in 2012, at first focusing on promoting our IR interest groups and symposia across the nation. But throughout the last few years, the MSC has blossomed immensely and is now comprised of 8 different committees with nearly 100 members in total, as well as an additional group of students involved in the Medical Student Reserves. We are immensely proud of the growth in IR, and more so the MSC. We know that with your help and continued student involvement, we will continue to pursue our mission. Next, we will discuss the structure of the MSC. It is led by the MSC chair with the help of our resident and faculty advisors. The MSC chair is a part of the governing council along with the 8 different committee chairs who are present currently. Each MSC member's term extends from the current annual meeting, which unfortunately, as many of you have heard, has been canceled for the year, but the term will continue to the next annual meeting, which will be in 2021 March. And with applications for these positions, which will be opening around this time of the year in proximity to the annual meeting. So please keep a lookout on that. Each of the 8 MSC committees is composed of approximately 10 students led by a committee chair. Their membership responsibilities include a monthly meeting where they discuss their committee projects and any updates to existing projects. The chairs of all the committees then meet separately once a month to share one another's projects and foster collaboration. For example, the education committee will present their new updates, and they will share that with the rest of the committees. As of last year, we have introduced the Medical Student Reserves, which takes applications on a rolling basis. As medical students, we understand that we all have limited time and our schedules can fluctuate depending on our current blocks and rotations. We have very dynamic schedules in medical school. The reserves, which is led by the MSR Medical Student Reserves Chair, circumvents this issue by allowing students to help on short-term projects with their limited time. And this process helps introduce those interested students to the MSC workflow and projects in hopes of transitioning to being a fully recognized MSC committee member. Now for introductions of the MSC committee chairs. Once again, I am Rayan Abboud. I'm an MS4 newly minted at the Wake Forest School of Medicine, and I'm honored to serve as your incoming chair of the Medical Student Council. I was very fortunate in getting involved with IR and the MSC during my first year of school, and much of that was owed to my mentors during medical school. Since then, I served as a member and then chair of the research committee. I have had the opportunity to collaborate with amazing medical students in the MSC throughout the past few years, many with a diverse array of talents and experiences. And I hope that you all may experience such incredible collaboration throughout your own careers. I owe a great deal of gratitude to the outgoing chair who's currently in audience, Hanson Lee. It is my hope to emulate his outstanding leadership and mentorship, all the while trying to uphold his compassionate and professional attitude throughout this upcoming year. So thank you dearly, Hanson. Now, shown here are the current advisors of the Medical Student Council. In the top row are our faculty advisors, Drs. Vatikan Shuri and Vishal Kumar, who operate within the Student and Resident Committee of SIR, which is SHARC for short, and they are faculty advisors. Additionally, their resident counterparts are Drs. Shantanu and Rakesh Ahuja, who are serving as the outgoing and incoming chairs of the RFS, respectively. And shown here are the members of the past year's MSC Governing Council, all the outgoing chairs. This evening, the incoming 2020 chairs will be presenting on behalf of their committees tonight. Now it is my pleasure to introduce the following MSC committee chairs, beginning with the Medical Student Reserves Chair, Siddhant.
Hello, everyone.
Hello, Siddhant. And we can continue to Saksham with the BIODESIGN and Innovation.
Hey everyone, my name is Saksham. I'm a second year at Rutgers, New Jersey Medical School, and I'm the incoming chair for the BIODESIGN and Innovation Committee of MSC.
Next, Education, Varun.
Hey everyone, my name is Varun. I'm a MS2, soon to be MS3 at Thomas Jefferson University, and I will serve as the incoming chair for the Education Committee.
Thank you, Varun. And next, with the Patient and Family-Centered Care Committee, Alexei.
Hey everyone, my name is Alexei. Currently MS3, soon to be MS4 at Sackler School of Medicine. Excited for this year.
Next, with PR and Communications Committee, Chase.
Hi everybody, I'm Chase Tenowitz. I'm a MS2 at Mercer School of Medicine in Savannah, and I'm the incoming PR and Communications Chair.
Thank you, Chase. And with the Research Committee, Sarvesh.
Hey everyone, my name is Sarvesh. I am a second year graduate student at the University of Wisconsin, and I am the incoming chair for the Research Committee.
Thank you, Sarvesh. Dudley, with diversity and inclusion.
Hi, everyone. I'm Dudley Charles. I'm a third year at the Icahn School of Medicine at Mount Sinai, and I am the incoming Chair for Diversity and Inclusion. Happy to be serving on the MSC.
And Norbert with IR Interest Group Committee.
Hi, everyone. My name is Norbert. I'm a third-year medical student at Einstein, and I'll be taking over as the IR Interest Group Chair.
Thank you, Norbert. And then we have Joshua Swee, who is our Web and Technology Chair for the upcoming year. All right, thank you all. We'll continue with our key accomplishments from the past year. So I will be discussing briefly the key accomplishments that we have undergone as the Medical Student Council. And some of these accomplishments that we'd like to highlight are our growth in terms of social media outreach and interest group expansion. They're shown above. We've continued to have growth in both of those categories. Additionally, we formalized the MSC membership through SIR recognition in the past year, owing to Hanson's leadership and efforts. We've also aligned SART, ECS, and RFS mentorship and collaborations with the MSC. So those would be both of the resident sections and attending sections and the resident section. We also have new sections for our website, including landmark trials, patient care resources, DIY skill trainer guides, and expanded IR procedure guides. We'd like to thank everybody involved in the 2019 and 2020 MSC Governing Council and memberships and committees. In regards to our growth, we appear to have reached a steady state in the past 2 years after an abundant growth period from 2015 onward. And we hypothesized that this small drop was as expected, and it will continue to oscillate until the interest in IR stabilizes over the next few years as IR integrated residencies solidify their place in the application process. Although, moving forward, we aim to continue along this upward trend and garner more membership and involvement. Although overall SIR membership for medical students has normalized over the past 2 years, we've seen an increased degree of involvement in interested medical students. So those students that are involved in the SIR have become more involved in the MSC and associated groups, as evidenced by the IR interest group membership, the IR symposia per year, and the reserves growth over the past few years, which we will discuss later. Charted here are the growth statistics for our social media platforms in the past year. We anticipate to continue expanding our reach through a newly revamped social media approach that was designed in the past 2 months and we continue to develop. So please reach out to us and apply for a membership position if you have experience in this sector. In terms of the chair's initiatives, my initiatives for this year include the following. I'd like to continue expanding our medical student membership and involvement at SIR with the IR interest groups and the medical student reserves. We also are aiming to support and expand IR interest groups and their symposia across the country in hopes of fostering stronger relationships with our colleagues at other institutes and help better promote our events, as well as developing support system between leaders from each school. A particularly important goal of mine has been to further integrate the MSC with our RFS and SAR counterparts to form intimate collaborations with upper-level trainees and faculty members. This process is underway, and we currently have very strong collaborations with those members. We also hope to expand the following. We hope to expand our social media reach and cross-collaboration within the MSC. Additionally, we will continue to refine our workflow and collaboration through Trello, with the RFS and SARC. We would like to foster peer-to-peer discussions on SIR Connect, SDN, and other platforms. We anticipate those discussions will be expanding as the SIR membership expands and becomes more involved. We'd like to add new subcommittees, including applied ethics in IR, and we would also like to advance medical student education and strengthen our educational resources in IR. Next, we'll begin with the committee-specific chairs, and they will discuss their growth in the past year and accomplishments, as well as future perspective goals.
Hey everyone, once again, my name is Saksham. I'm the incoming chair of the BIODESIGN committee. And what our committee has are 4 major goals, which are on the slides here. The first goal is that we want to expose IR to all medical students and early trainees. And we want to expose them to the biodesign and innovation facets of IR. As we all know, IR is a field where innovation is at the forefront of everything we do. And biodesign and our committee hopes to get that excitement and teach more people, more medical students, more early trainees all about that. And that brings us to our second point. We really want to educate students about what biodesign is all about and teach them the basics through a series of webinars and lectures and teach them how to begin to think like innovators. And in order to do that, we challenge medical students with different problem solving opportunities, and we challenge them to get more involved in innovation and biodesign within the field. And it's a great chance to learn more about what IR does and how it's going to change in the near future. And finally, we collaborate with a lot of other committees, both in RFS and within MSC as well. And I'll be talking about that in the next couple of slides. So just some brief points about our previous accomplishments. So this year we hosted our main project is the biodesign competition, and this year we hosted a biodesign competition with our theme being global health and IR. So we sent out a bunch of prompts, and we had 16 attending judges and 14 teams registered to solve some sort of problem within global health and IR. And these teams ranged from medical students, and some of them even involved interdisciplinary students from across the country. So at the end of the day, we had 8 total submissions, and 2 top teams were selected by 16 attending judges to give oral presentations at the biodesign workshop that was supposed to be held at the annual meeting. Since the annual meeting was canceled, we're planning on hosting a webinar instead. And from that webinar, where the top 2 teams will present their projects, attending judges will score and select the top team to win the competition. So a couple of other things we do along the same lines as our biodesign competition is host webinars that are related to our competition. So we hosted an introduction to biodesign webinar early in October, just to get teams and medical students interested in and give them a brief sense of what biodesign is all about. And around the same time is when we released the prompts for the biodesign competition so that teams could use the information they gathered from the webinar and kind of get more involved in a hands-on approach. And then something else we did very recently at the end of February was we hosted a webinar where we had a guest speaker, John Brumley from Cook Medical, and he gave us a sense of what biodesign in industry is like, what makes a product successful. And at that webinar, we also had a bunch of our top 8 teams from the biodesign competition give a brief overview of what each of their proposals were. So like I said, the main project that the biodesign competition focuses on is that the biodesign committee focuses on is the biodesign competition. And one of our goals every year is to improve and refine the competition through surveys and feedback. And some of our goals for next year are to expand the reach that the biodesign competition has amongst the medical student teams. So we want to enroll at least 10 IRIG teams throughout at the next year's competition, and we were considering expanding to international groups next year so that we can get more of an international presence. I think there was a lot of interest, but the timing didn't work out this year. But next year we hope to make sure that everyone, even internationally, is able to join the competition. And we also want to introduce a regular series of webinars that kind of follow a same sort of theme. And these would feature interventional radiologists, innovators, and experts in product development, similar to what we've already done before. But a couple of topics that we're looking into doing are introduction to the biodesign process, like we've already done, but also needs finding and screening, career highlights in device development. So industry leaders that have, physicians that have already developed devices, what they've done, what that process was like, and what the new technologies in device development are like. What's the future of IR going to feature? A couple of other new projects we started this year are one was an MSC collaboration. So we're in the early stages of coming up with a sort of cookbook for a mini biodesign competition that could be hosted at individual IR symposia across the country, where students that come to the symposia could get hands-on experience with a small sort of biodesign workshop. And it would really educate them and get them involved in what IR is all about and what biodesign is all about. So we're working on this workshop, and that's some of the it's part of the collaborations we're doing within the Medical Student Council. Within the Resident Fellow Council, what we're doing is we're working on a new project that we started very recently to expand a section of the SIR website that details what the latest innovations in IR are all about. And these can range from things like 3D printing, what it could be used for, to things like technology and communication with physicians, to other things like new devices and new techniques that are being developed. It would be from a combination of social media posts and research papers that have already been published, put really together in one spot for medical students, physicians, and anyone interested in IR really get a sense of what is the latest in IR, where is this field going, not yesterday, not today, but in the next couple of months or in the next couple of years. And we've actually recruited a couple of members from the MSC reserves to help us out with this project. So we're really looking to recruit more members to fulfill these the needs we have for the projects such as this. So if you are interested in being a part of any of the projects that I talked about, be it the biodesign competition, be it the new innovation website or the IR workshop, or if you're interested in bringing a new project that you have in mind, feel free to reach out at sir.msc.biodesign@gmail.com, and please do apply when the applications go out for the Medical Student Council.
Thank you, Saksham. Next, we'll continue with the Education Committee with Varun.
Hey everyone, Varun here from the Education Committee. Before I begin, I just want to give a shout out to Ilana Breen, who was the previous Education Committee Chair, who has done a phenomenal job in leading the committee this past year, as well as also mentoring me and guiding me through the transition process. So to start, the mission of the MSC Education Committee, as the name suggests, is to educate people, primarily medical students, prospective patients, and the general public. And the way we aim to do this is by creating educational materials such as educational videos, content outlines, and then potentially even other mediums such as problem sets or Anki decks that we hope to explore more in the upcoming year. Next slide, please. In terms of the work that the committee has done in the past, you can find us on the SIR RFS website through these links. If you go on the Medical Students tab, you can click on the Introduction to IR button, and then that'll bring you to this page where you can either read about common IR procedures or watch some common IR procedures, which will also be on the YouTube channel, which is linked. Yeah. In terms of on the YouTube channel, there's not only content from the MSC Education Committee, but also all the recorded webinars are there. So if you haven't checked that out, there's a lot of cool content on there. So I would definitely check it out if you haven't already. So in terms of our main project for this year, and actually this past year as well, it is the Introductory IR Curriculum Initiative. So the main purpose of this project is to create a series of introductory IR modules that are organized by organ system. So for example, there's a module for the cardiovascular system, a module for the GI system, a module for the venous system. And since IR is involved in the treatment of so many different pathologies and different organ systems, this organization lends nicely to that aspect of IR. So the goal is essentially to introduce students to IR fundamentals and then give them a strong foundation that they can then build upon by reading more advanced resources. I think we identified that there's a lack of kind of basic IR education materials, and the hope of this project is to bring people to the point where they have a strong IR foundation, and then they can then learn more about IR through some of the more advanced resources that need kind of some baseline knowledge. So in terms of each of the modules, you can see in this kind of schematic I have here that some of you might be familiar with the resource boards and beyond. So that's one of the resources that obviously is very successful, and we're hoping to base this project on that. So each of the modules will have a video lecture on each of the subtopics within the module. So you can see in this example, there's the cardiovascular medicine module, and within there's 4 subtopics. And then each of those 4 subtopics would have an accompanying video lecture, and then a written compendium, which is essentially a notes of the video. And then along with that, there's also question sets to test your understanding, and then hopefully an accompanying Anki deck. Thank you. So here is just kind of like a smattering of some of the screenshots from some of the work that we've done over the past year. This is from the cardiovascular module. And you can see that the goal is essentially to create a very kind of baseline knowledge and connect it whenever possible to preclinical concepts. So for example, like risk factors for PAD is something you learn in the first years of medical school. It's the same as coronary artery disease. So whenever possible, we want to kind of reinforce concepts that are very high yield for the first 2 years of medical school, and then expand upon that by introducing the IR concepts that are related to that, such as treatment, medical management, complications, and etc. So here's the anticipated breakdown for the different modules of the project. I've been talking about the vascular module, but the oncology module, the pulmonary module, and the neuro module have all been in progress this past year, and are actually nearing completion, some of them, which is really exciting. For this next year, we're hoping to start expanding to some of these other modules on the right side of the screen. And we're really hoping with the recruitment of new MSC members during this application process that we're able to get a lot of passionate members that may be passionate about one of these perhaps unstarted modules, and then we'll be able to build a team around them to start working on them. The MSC Reserves has been a really great contributor to this project, and since it's such a big such a huge project, it's really great to get assistance from them, and it's been a really great collaborative experience so far. Okay, in terms of other projects, the other really cool project that we've been working on this past year has been the IR for Kiddos project, which is headed by Amy Crum, one of the members of the Education Committee. Essentially, the goal is to create age-appropriate resources for kids that are undergoing IR procedures to help them learn what to expect. And this can be in the form of comic book strips, pamphlets, fun videos, or even coloring books, which is what this is an example of on the screen. So this is a super cool project, and it's more geared towards students that kind of have the artistic aspect of themselves that they would like to explore. And hopefully we'll be able to create a lot of great resources for kids that are undergoing these types of procedures. The other main goal of the committee this year, I would say, is to start more inter-committee collaborations. For example, one thing that I'd really want to do is collaborate more with the IRIG committee, which I believe is speaking next, and then essentially use that kind of connection that we have with the different IRIG leaders all around the country to disseminate the materials that we create through the committee more easily, and then spread the word to essentially as many medical students as possible. So that's all I have. Thank you everyone for listening in. If anyone has any specific questions about anything I talked about, or any other specific questions about the committee in general, please reach out at msc.education.committee@gmail.com. Thank you.
Much thanks, Varun. Next, we'll move on to the IR Interest Group Committee with Norbert.
So hi, everyone. So my name is Norbert Cook. I'm the incoming IR Interest Group Committee Chair. Our outgoing chair, Lisa, has done a lot of great work over the past year, and I'm excited to share some of what we've accomplished and what we've been working on. So the IR Interest Group Committee's mission is to promote medical student involvement in IR by supporting the activities of IRIGs and setting them up with the resources they need to succeed. Next slide. So over the past year, we've been able to continue expanding the number of interest groups registered with SIR. A lot of the success is attributed to our members, which are constantly in contact with IRIGs across the country. We're always working with motivated students to either start or expand existing interest groups. We're also supporting medical students looking to host IR-related symposia, and this year we've focused on increasing collaboration between schools. So to that end, we've seen a 50% increase in the number of collaborations to form regional symposia, and as a result, these symposia have increased in size, and we hope that that better facilitates networking and attracts more participation. So the IR Interest Group Committee has a variety of projects. Most of them were started by previous members who had certain. There are plenty of ways to support medical student involvement in IR, and the diversity of our projects reflects this. So currently our main project is the Interest Group Liaison Project. Our members are each assigned an interest group or a group of interest groups that they regularly communicate with. And our goal is to establish a relationship with the interest group where we can offer support and serve as a point of contact with the Medical Student Council for distributing news or certain resources. And one example of the resources we've came up with is the IRIG Roadmap. That's a resource we recommend everyone check out for advice about starting and growing an IR interest group. It has a lot of answers to commonly asked questions. And then another project that has been very successful is our symposium subcommittee. Jordan Wells is the outgoing member who's done a lot of great work on that project in the past year. This group supports students looking to organize IR symposia. We have a cookbook that guides symposium planning that we're constantly updating. And we highlight IR symposia on social media and on the SIR website. For the past 2 years, I think the biggest thing the symposium group has been accomplishing is the SIR virtual symposium that was held at the University of Colorado. Jordan did an excellent job figuring out the logistics for that and advertising it. And of course, we're hoping to continue that event in the future. So we're definitely looking for people who would be interested in taking over that project. Another one of our more recent projects has been the Diversity and Inclusion Initiative that's led by one of our returning members, Simone. The goal of this project is to reach out to schools with limited IR resources and DO schools. The initiative helps connect students with mentors and resources to explore IR, and it will be expanding in the coming year to include online webinars and meetings to hopefully facilitate more collaboration between the IRIGs. And finally, we have a pre-med outreach project that's also pretty new that targets undergraduate students to expose them to IR pretty early on, where in a setting where most people wouldn't even know IR exists. So the project team did a fantastic job creating an intro to IR PowerPoint and webinar, and we're distributing it to all the different pre-med committees at various universities. So moving on to some of our new projects. So under the leadership of Lisa, the IRIG committee created a proposal for a new point system for IRIGs. This system allows IR interest groups to earn points by holding events, updating the liaisons they're assigned, and having members register with SIR. So at the end of the year, we hope to highlight the winners and have some kind of prize that's IR related. We hope that by incentivizing communication with the Medical Student Council, we can increase our response rates, keep IRIGs more closely associated with the council, and really foster more collaboration. Another new initiative we're starting is creating regional groups, smaller groups of regional IRIGs. We're going to use these groups to host regular online meetings with IRIGs in certain areas where they can share ideas about what worked, what didn't, and what they needed help with. We hope this will increase some communication between schools, the sharing of ideas, and hopefully lead to more active IR interest groups. And we always like to encourage our members to do what they're passionate about. So if anyone has a new idea, we are more than willing to work with anyone to integrate it into some of our existing projects. So for our goals for the upcoming year, our number one goal is to have the most updated contact info for all of our IRIGs. This is super important to us as we can't do our job without it. We've had a lot of success so far working with the medical student reserves to find these contacts, but this is an ongoing project to really get the most updated contact info, especially as IRIGs tend to switch off their leadership yearly. Another goal is to increase the communication between IRIGs and the Medical Student Council, and we're exploring new ways of improving outreach, including through the SIR Connect forums. This year, we'll also be continuing to support student IR symposia with the goal of having larger and more collaborative symposia in each region, as well as we're going to be supporting the schools who are doing their own independent symposia as well. We've had a lot of good success with the SIR virtual symposium in the past 2 years, and we're planning on having the 3rd annual one this year again in the fall. Finally, through our diversity and inclusion outreach project, we hope to continue increasing the number of IRIGs nationwide. We're going to be reaching out to more underrepresented schools and helping them start interest groups, increase our medical student exposure to this field. So thank you everyone for listening, and I hope you consider joining the IRIG committee this year.
Thank you, Norbert. Next, we'll move on to patient and family-centered care with Alexei.
So, hey everyone. First, I'd like to thank Samir for his help and guidance throughout this year. I definitely learned a lot from him. And as the name of the committee can tell you, we're trying to focus on the patients and see how we can help them and also they can help us. So if you like, next page, please. So we understand there's currently like a strong push for IR to become an independent specialty. And this brings us to the forefront of patient interaction. And therefore this committee would like to serve as a resource for both patients and trainees. So first, we'd like to empower the patients and their families by providing educational material related to the patient experience in IR across a variety of the procedures that they may face. And secondly, we also seek to better prepare medical students for practice as IR switches from more of a procedural to a patient-centered medical specialty. Next page, please. Over the last year, we were focusing on several ways to expand our content. First, we were working on patient narratives, which are basically transcriptions of patients' experience during procedures. We find it's really helpful as when other patients are able to read these, they get a better perspective on what can be expected of them. Next, we're working on physician interviews to create a sort of simple introduction to the procedure and the potential diseases for. Lastly, along the same lines, we're working on what to expect presentations, which are going to be bundled, as I explained later, together with the previous 2 projects to provide sort of a well-rounded scene for the patients. In the meantime, we were also focusing on some of the articles, especially by Alan Nathane. He did a great job working on Twitter and IR and also recent updates on PFCC research. Now, for this year, we are working to expand the library of patient narratives, physician interviews, as well as what to expect presentations. We do believe we've been doing a good job with these, but the main challenge will be to create templates which are easily reproducible for next year's and so on, so forth and so on, because there's a lot of procedures to overgo, and this will speed up the process much more. Then the information brochure with the IR initiative. For the IR initiative, this is a third-party content that does a similar project, and we're seeing ways we can help out, work with them, see how they can help us, and also explore the roles of consent and shared decision making. This will be a qualitative research rather than quantitative, and we're excited to start with them. So the information brochure, that's something I mentioned previously. It's just a concise and informative way to inform the patients. And lastly, we'll be working on webinars to see how you can improve patient interaction and assist in future education. Next page, please. So overall, as we mentioned several times, our goals are to facilitate development of a more patient-centered focus in IR. One way we're doing this is through the brochures for patient education and making the templates for future exploration. One way is for looking at the roles of consent, which we know is so important, and we want to make sure that the patients fully understand consent and share decision making. And lastly is a resource for the actual trainees to see as how stepping into the role of a primary team-led course can change your perspective on patient care and how we may further improve the interaction between medical students and potentially residents, as well as other patients. Thank you.
Thank you for that update. Now we have PR and communications. This is with Chase.
Hi, everybody. Again, I'm Chase Senowitz. I'm taking the place of Adam. Adam's done a great job over the past year, and he's been a huge help throughout the start of all of this. Next slide, please. Okay. So just to kind of go over the main roles of the PR and communications. So we provide useful, educational, and exciting content that serves to inform and attract medical students and undergraduates to the field of interventional radiology. So as of right now, we've really used Facebook, Twitter, and Instagram to kind of get the content out there to try and get students interested in IR. Those have kind of been the main platforms that we have used in the past. Next slide, please. So then just like going off of that, I'll go ahead and talk about some of the key accomplishments that they've made in the past. So to start, they've created some IR guides, specifically one that's kind of come out recently was a medical student guide to consulting IR. And in the future, we hope to kind of keep on making these guides and help make these guides and then get that content out there so other people can see it. And then publish certain SIR medical student articles. Recently, one of our PR members just put out the So You Discovered IR Late in Medical School. And then they kept on with the continuation of the Physician Spotlight. And one of the big projects that Adam took on and I was actually a part of, and then other people were a part of, was the revamp of the Wikipedia IR page. So basically with this, they got a group of reserve members, and then with those reserve members, they put together these sections related to IR, such as like vascular, oncology, GI, and so on. And then they got the physicians to review what they had written, and then we actually put it up online. Next slide, please. Okay, and then going on kind of to talk more about the social media platforms. So recently I was looking up some of the analytics behind the Facebook. There was a large increase in the Facebook followers at the beginning of February of 2019. There was 1,223, and we almost doubled it coming into February of 2020 with around 2,259 followers. And then with Instagram, so that's something that's a newer thing that we have added. We're trying to incorporate a significant amount of posts to just get the attention of everything, and we're really trying to incorporate the Instagram story feature. Seems like a lot of the younger generation like Instagram as their social media platform. So that's where we're trying to focus a lot of posts on there as of recently. And then as well, I mean, it seems like a lot of people are using Twitter as well. So we're trying to get a lot of content out there by making posts on Twitter. And you can kind of see there's some of the charting for the amount of followers that we've added. Next slide, please. Okay, and now moving on to kind of future projects and the future goals of the PR and Communications Committee. So social media wise, we're going to continue with the Physician Spotlight series and try and create content for that. I know this is something that we'll do with the Diversity Committee. And then I guess just keep on with the advertisements of the specific RFS MSC events. And then continue with the SIR student articles. A recent change that we've added is the Twitter champ, where we're going to start getting a medical student to take over the Twitter account and just release certain content related to IR. I'm actually the Twitter champ as of this month, and I've incorporated a thing called the SIR Featured Friday case. So basically, I'm trying to get the residents' content out there more, and also medical students as well, where I'll pick a certain really unique case for that week and then retweet it out and try and get attention towards that person. And so another focus that I really want to take in the future, and as of right now, I think we haven't really had a big outreach to the undergraduates. So I feel like the best platforms for this are Student Doctor Network and Reddit, where I'm going to make posts every single week, just to kind of, it'll be certain posts like introductions to IR, introduction to procedures, and get that out on Student Doctor Network and Reddit and the pre-med forums, and as well as the med student forums. And then I'm also going to continue with a Wikipedia revamp. As of right now, it's kind of blocky. It needs to be formatted better. And we're going to add some images on that as well, just to kind of make it more visually appealing and keep everybody's attention as they go through the document on Wikipedia. Next slide, please. Okay, and then again, this last slide, just kind of talk about the future project and goals. So just continue with writing quality, up-to-date articles about topics pertinent to students. So with the whole Twitter champ, we really want to integrate this to different social media platforms. So with the success of the Twitter champ, we're going to integrate this into Instagram at some point. And then kind of going off the whole Student Doctor Network and Reddit, I'm going to have certain posts every week and try and get more attention for the for IR to the undergraduates. And then last thing, so this is something that I've recently tried. I'm trying to reach out to undergraduate societies such as IEEE, BMES, which I think we get the biggest outreach to the undergraduates. We need to find undergraduate societies, and I'm trying to link up SIR and these organizations for the future to kind of get IR content out to those areas. And yeah, if you have any questions, just email the sir.msc.prcc@gmail.com. And if you're interested and have some good ideas for getting bigger outreach for IR, definitely apply. And thank you for the time.
Thank you, Chase. Really excited for those projects. Next, we'll move on to the research committee with Sarvesh.
Hey everyone, my name is Sarvesh again. I'm an MD PhD student at the University of Wisconsin, and I am taking over for Rayan, who has done an incredible job expanding the scope of the research committee and initiating a number of projects that address all things IR research. So broadly, the goal of the research committee is to train students on how to make IR better and bigger, and that's through basic clinical and translational research. And so more specifically, we want to educate trainees on how to participate, interpret, and share research, which are all facets of research that are important, not just doing research, but getting your research out there and understanding the research. We want to make IR research more accessible to medical students, and we have a number of different projects on how to communicate big studies that are happening in IR. And then we want to enhance connectivity between medical student researchers and IR faculty, especially as the specialty continues to grow. So, as I mentioned before, one of our major initiatives is to expand literature outreach, and so one of the projects doing that is the Future of IR series. And so all members of the research committee review 2 landmark articles in interventional radiology research that they get to choose. And then they read the article, summarize it in about 1 to 1.5 pages. And this review is then reviewed by a resident from the RFS. And then these are posted on the RFS MSC website. And so this has been a really successful project that has had a lot of involvement because all students in the committee are involved in it. And so the diversity in articles is really broad, so we get a lot of different perspectives. And so it's good for the committee members because they're also learning, but hopefully this is a good resource for medical students who are doing IR rotations or trying to get more interested in the field to learn about the new and exciting research that's happening. And kind of similar to that, I'm sure many people here are familiar with Anki. For those that are not, it's a very popular flashcard tool that's used in preclinical and clinical rotations by medical students. And so I think we wanted to leverage that by having a lot of these Future of IR landmark articles summarized into a more short form in these Anki decks and Anki cards. And this has been a project that's been collaborating with MSC Reserves, who have been wonderful in helping us create these cards. And so hopefully, you know, students that are maybe on an IR rotation or in their clinical rotations can use these cards to supplement their shelf studying or whatever else that they're doing on their rotations. And so I think anyone that's rotated in a procedural specialty knows that sometimes it's important to know when to intervene and sometimes it's important when not to intervene, and really that decision is made based on a lot of these landmark articles. And the last one is we want to include a web-based journal club. And so students in the research committee reach out to faculty members at their institution or maybe at another institution and summarize an article and then have a short 10 to 15-minute discussion about that article with the faculty members, asking different questions. What are the strengths of the study? What are the weaknesses of the study? And then these journal clubs will be posted and made available to all medical students. So again, another avenue or another method for communicating research in IR. In terms of mentorship, I think most people would agree that in order to perform successful, meaningful research, it's important to have good mentors. So we have a couple projects addressing that. The Spotlight series, members of the research committee either interview a medical student or a physician and ask them about their research and their involvement in IR. And these are posted on the RFS website. And so this is a great opportunity for people to see what's happening with their fellow colleagues around the country, what different mentors are doing around the country, and hopefully if you run into them at a meeting or on the interview trail is a good way to connect with them. Another project that's been really exciting is the Multi-Institutional Research Initiative, and this has been spearheaded by Matt Parker, who is a resident in the RFS section. And so as IR has continued to grow as an independent residency, more and more medical students are trying to get involved in IR research, but it is still a relatively small field, and sometimes the research is a bit specialized and requires special skills. And so the aim of this project is at each institution set up an infrastructure for connecting interested younger medical students with IR faculty at that institution, and to do this in a standardized way. And so this is started by Matt Parker at his institution, and another member of the research committee, Joey Knox at UCSF, has been helping a lot with this. And so the idea would be you would give them the materials so that they could set up an IR research program at their school, which would connect physicians and students, would keep a database of students that have performed research, what skills they have, who would be a good fit for what project. And just to make this whole process of students finding research projects more standardized and hopefully more successful. And one of our last initiatives is educational resources on how to perform and be involved in research. So one that's really taken off this year is the research white pages, which has been a big collaboration with the RFS. And basically, we're trying to call it a series of documents created by members of the research committee that address any and all things related to conducting IR research. So this could be, as you can see in the picture on the left, what publications are relevant to IR research and how to publish in those journals. This could be how to analyze data. This could be how to interpret a clinical study. If you're doing basic science, how to do tissue culture. And so the scope of this is supposed to be very large. And so we've started, and we have a series of about 8 to 9 articles that have we've already had written up and reviewed. But the aim is to put this on the SIR RFS MSC website and make this available to everyone so that medical students around the country, if they're interested in getting started in research in interventional radiology, they have resources where they can look to for different aspects that maybe it's more appropriate for them to figure out on their own. And then the last project I want to talk about was iTrope, the Introduction to Research online program. Again, this is another one where we've collaborated with the RFS, and this is supposed to be a web-based curriculum for how to conduct research. And so members of our committee are helping to generate content for this web-based curriculum, and the RFS has done a lot of work in trying to implement this as well. So for the upcoming years, we have a couple of different goals. One is to build projects that introduce medical students to the peer review process. I think that's something that's a bit underrated when people think about research, is how are abstracts for conferences reviewed? What are reviewers thinking of when they read your manuscript? Or if they're submitting a grant related to interventional radiology research, what are things that the reviewers are looking at in the study section? And so we want to introduce either workshops or resources that address this part of research that I don't think is addressed enough. Another thing we want to do is collaborate with the other committees in the MSC, including the Education Committee. We are thinking about maybe developing visual media in addition to all these literature resources that we have for how to conduct research and how to conduct procedures. And the last is connecting medical students that are attending interventional radiology and radiology meetings. So conferences obviously are great for education and for scientific purposes, but I think networking is also a huge part of attending conferences and developing relationships with other medical students and other physicians. And so we want to be able to develop a standardized ways for people or students that are attending meetings to know that there's other students there. How can I connect with them? Can I go see this medical student's presentation? So, I mean, overall, we just want to give medical students the tools to get excited about, succeed in, and make connections within the IR research community. And it looks like it got cut off there a bit at the bottom, but if you have any questions or any suggestions for the research committee, please feel free to email us.
And you can contact sir.msc.research@gmail.com.
Thank you, Ryan. And again, here's all of our different projects.
Thank you, Sarvesh. And we'll move on to diversity and inclusion with Dudley Charles.
Good evening, everyone. I'm Dudley Charles. I'm a third-year medical student at Mount Sinai in New York, and I'm the incoming chair for diversity and inclusion for the MSC. I'd like to extend a particular thank you to Shannon Sullivan, who's our outgoing chair. Next slide, please. So the mission of the Diversity and Inclusion Committee is to promote diversity of trainees entering the field of IR, to provide IR outreach initiatives, and contribute to patient advocacy within underserved patient populations, and also to collaborate with and support the efforts of the SIR Diversity and Inclusion Recruitment Committee and the SIR Diversity Task Force. Next slide. So the current projects we have are, we have a minority treatment awareness outreach program. So it's two-pronged. So one is geared towards highlighting some IR procedures and treatment options for disease states that disproportionately affect certain demographic groups, and also educating the broader IR community of health professionals on these health disparities and encouraging them to address community needs. So part of it is seeing how we can have outreach to patients and outreach within IR itself, in terms of educating our peers and colleagues on what to look out for and particular populations to look out for, especially now that IR is becoming more of like the first stop for patients. And as some of you may have seen in IR clinics, the patients are going directly to the IR as opposed to being referred. So another project we're working on is a peer-to-peer mentoring program with mini sessions with residents. We're attempting to establish a list of women, underrepresented minorities, and those on the LGBTQ+ spectrum of medical students and residents to connect for just general mentorship, emotional support, and opportunities at their respective institutions. Also, we are working on a patient education group of projects that highlight specific IR procedures, which is ongoing, and we hope to work with the reserves on it, because it's going to be a kind of a platform that has a potential to have a lot of opportunities for people from the reserves to get involved, depending on the specific procedure that we're highlighting, and that we're gearing that towards our minority medical student organizations and associations nationwide. Based off of what I've heard in the last presentations, there seems to be a lot of educational development going on, but I don't want to, create redundant content that is already being developed for other medical students and residents. So we're going to gear it more towards our national medical student associations. And lastly, the minorities in IR, women in IR, we hope to establish we hope to continue to use the SIR Connect platform to help establish long-term mentoring between women and underrepresented minority students. Next slide, please. So as Chase mentioned, we have been highlighting some physicians, some underrepresented physicians and women physicians in IR to disseminate on social media to show that we do have diversity in IR, and to get people excited about some of the things that some of these IRs are working on, and to potentially see themselves in those roles. So last year we've submitted some spotlights via Twitter, Instagram, and Facebook, and we hope to continue to do so. Also, in terms of the treatment awareness outreach program, we have an example of it on the right. As you can see, we typed up something about deep vein thromboses and PEs, explaining what they are and how IR got involved, and highlighting some famous people who've come across interventional radiologists in their medical workups. This is also to just get others involved and to see what IRs can do. In terms of our outreach to interest groups, we identified 22 DO interest groups and schools that have a high underrepresented minority presence. 9 of them are MD and 10 are DO, and we hope to establish collaborations with them and to work with their interest groups. Next slide. So our 2020 goals are to increase our committee membership in the upcoming application cycle to bolster the projects we have. We're going to continue to do physician spotlights 2 per quarter, and we already have some underway for this first quarter of the year. I've developed a MSc in Reserves demographics questionnaire, and this is something that was requested by Dr. Kumar. We'd like to just get a sense of the identity makeup of the MSc and Reserves to then tailor projects and mentorship accordingly. So I will I'll work with Ryan to send out the link to that survey to you all so that you can send it to your committee so that we can start gathering some data. In terms of the monthly treatment awareness program, we're working on something for March for Women's History Month, particularly talking about UFEs and HCC RF ablation in the context of tribal beliefs. In September, we're planning on doing something for National Hispanic Heritage Month in the context of IR treatment and chronic liver disease. Throughout the year, we're going to be continuing to work on creating a list of willing residents who will be willing to mentor medical students and checking up on them periodically. In addition, we're going to try to increase IR visibility among minority medical associations via our presence at SNMA. Now, considering SIR has been canceled, the AMEC conference in April stands the risk of being canceled as well. So we're working with Dr. Kumar and Dr. Rokan at the University of Colorado to develop alternatives in case the AMEC is canceled. And we hope to collaborate with other MSc committees in order to provide help where they need it and to garner some help from them for our projects. Next slide. And so that's all I have. If anyone has any questions, please feel free to email me at dudley.charles@icahn.mssm.edu with any questions. Thank you.
Thank you, Dudley. We'll move on to medical student reserves with Sid.
Hi guys, my name is Siddhant. First of all, briefly just gonna say a big thank you to Lindsay, who's the outgoing chair for the medical student reserves. There's a lot of people that are involved with the reserves and a lot of organizations and committees, and it simply wouldn't have been possible if it weren't for her impeccable organization abilities and her fantastic trade-off and training to get me involved and get me started. So I'll quickly talk about some of our what the mission of the reserves is, as we are a little bit of a different type of committee within the MSc. Really, we try to serve as a companion organization within the MSc and the RFS to really connect students who are motivated to get involved in IR, SIR, and the student committees with projects that are manageable with their medical student curriculum, with their medical school curriculum, and also provide them with exposure. At the same time, we also like to create content for the committees, as you may have heard with some of the presentations prior, and we try to extend everywhere so we can really fuel some of the projects that are already going on. Next slide. So in terms of really what we've tried to accomplish is, first, with the recruitment, we've currently have about close to 150 members. This number is quite high, but I do suspect that it will go down come this March when a lot of our members will be converted to MSR alums. Roughly, we're seeing about 10 or so applications every month. So our outreach into making sure the MSc reserves is an option for students who want to get involved has been extremely successful. So with that, really my goal has been in making sure those students who want to get involved find a project rather than keeping them on hold. So that's a challenge both for me and one that I propose to the rest of the Medical Student Council is there's lots to be done. So please reach out to me, and as I will do the same in trying to reach out to you in case you need more manpower and just more motivated people to help you complete these projects, because we are increasing in number, and I think in order to sustain this level of energy, we also have to make sure we're giving those who are motivated with projects in a timely manner. But the next slide, please. So just quickly as to some of the things we've done, I know a lot of these things have been mentioned in the past by other committees. We've really worked on randomized clinical trial summaries. One thing I'm particularly proud of is the procedure guide, something I personally use myself in clinic. Essentially, these are just focused on individual procedures. Then they hope to provide a quick, brief background on things that IR do. A lot of people who have worked on this project have found great pleasure in creating these procedure guides, as it's been both educational for them and it's also helpful for the rest of our medical student committees. And finally, we have a lot of support for the IR Education Committee, and they too have been very receptive of our reserve members via projects such as IR for Kiddos. And we've completed a few of those, and hopefully the whole project itself will be completed in a short time going forward. So next slide, please. Really my goals going forward right now are to obviously get more involvement. As I mentioned before, some of the things would include the IR pre-curriculum modules, which were mentioned before. I'm really getting a lot of reserve members excited about that, and as soon as that gets started on full force in the next coming months, we'll definitely have the power to fuel it. We've been working a lot with the IR interest group committee, sending anyone who doesn't really have an interest group at their school to the right people, making sure that they get the guidance and they're hooked up with SIR, and then make that process easier for them. And finally, we're also trying to increase our community outreach, inclusion, and diversity, and this has been a collaborative effort among the reserves and the rest of the committees as well. And so next slide, please. So I will leave with this, how to join the medical student reserves. This simply can be found on the RFS website. I've linked an example here. The application is pretty straightforward. I like to review these applications, really focusing on what the strengths of the applicant are, not so I can critique them or anything like that, but so I can connect them with the relevant committee. And so far, I feel like we've been extremely successful. I've gotten great feedback, and in that same regard, I'd also like to say thank you for all the committees who have accepted reserve members, and I'd also like to invite committees who have not done so yet to please reach out to see if there's any way we can get involved. Also, as I said before, we are increasing in number, and I'd like to keep that enthusiasm going. Anyways, I'll leave with that. My contact information and my email is right below. If you have any questions, feel free to reach out. Thank you.
Thank you, Sid. We'll move on to web and technology with Samantha.
Hi, my name is Sammy. I am not the incoming web and tech chair, but I am one of the outgoing ones. I've had the pleasure of working with a small team, and 3 of us are hopefully going to move on to residency, and the one who's remaining, Josh, will be the next web and technology chair. I believe he just couldn't make it to this meeting today. Next slide. You could like click through the, yeah, so we work together with everyone who has talked before me, basically to showcase all of the great work that they do on our website, which is located at rfs.sirweb.org. Next point. So we really want to focus on making the website easy to navigate, user-friendly, and also able to accommodate just this huge amount of great stuff that all of the other committees are coming up with every week, every day, because it all deserves to be shown. And but we also don't want it to overwhelm this one site. Next. And then also we want to align ourselves with the national organization, their website is simply sirweb.org, and in working with them, we can show a unified front and just appear to be supported by the IR physicians at the attending level as well. Next slide. So stuff that we worked on this year, we did try and incorporate the colors more into the website, and it's a small thing, but we changed the entire font family of the website to match that of sirweb.org. And also we wanted to make sure that the website is easy to navigate instead of, you'd rather it not be a collection of, random posts. We want it to all connect to each other and all have a logical place on the site. As you can see, we have a good amount of different topics that are actively being written for, including, people before have mentioned the Future of IR series, the Spotlight series. And so we just want to make sure that if anyone wants to go and look for this stuff, they're able to find it. New website sections that were added to the website this year include the patient care resources, which houses stuff like the IR for kiddos brochures, and also consult worksheets for practicing physicians. Also, the Landmark Clinical Trials site is where they hold all the write-ups for important trials in IR. And also we opened a site called Apply to IR, just because so much was being written about the new integrated track and also ESIR and the independent track, and we wanted to have one place for someone to go and be able to browse all of those topics. Next slide. So on this page, I just kind of wanted to show you the updates we made. In the top left is the old site with the old font, and you can just kind of see that it looks good, it looks great. But the one on the right is after we changed everything to kind of match the SIR website, which is in the bottom left. That's the national website, and you can see that the font is the same, and also like on the bottom right is an example of one of the pages we have, and we're just trying to have our colors match theirs as well. Next slide. And so the future goals that we have, we're going to continue to try reorganizing the website's structure. There are some projects, including the white pages project that was mentioned before. In addition, we've been asked to open a whole new section for the BIODESIGN committee. And so we want to make sure that there is a great place. There is a great place. We are just going to make room for them soon, and also just continue to be able to accommodate all of the great stuff that's written by the committees and the reserves on an ongoing basis. A huge part of that will be going through and taking down any old stuff that hasn't really been touched in a while. And then also, as a personal project, I want to give the homepage a facelift, maybe update the graphic. We're always working to have a better response times for requests from the rest of the committees. We're a small team, and we totally understand and apologize if there's any sort of bottleneck in terms of getting stuff up on the website. But we look forward to working with you guys in the future, and especially appreciate the talk about increasing and continuing to work on social media presence, because we do notice that the traffic to the site and in the analytics data, the views and the time spent per post, it takes a big bump every time you we post something on Twitter or on Facebook, we notice the traffic will increase for a little bit. So it's a good opportunity to really work well together and get IR stuff out there. Next slide. I think that's it for me.
Sammy, thank you so much for your continued help and really excellent work. We don't know what we would do without y'all. Thank you again. Last but not least, I'll be discussing tips for application success, and the application timeline for this year will be the following. We will open the application period starting on March 21st, and they will be available at rfs.sirweb.org. Afterwards, the applications close at 11:59 Eastern Standard Time for the Medical Student Council, and that happens on April 12th, so the night of April 12th. Any applications received after that period will be considered for the reserves section of the Medical Student Council or the RFS service line. Later, after that date, for about 2 weeks, we will review the applications and they'll be carefully read and evaluated by all of the chairs. And then in the last week of April, decisions will be finalized and we will contact the applicants in order to give you feedback on where to go from there. So some tips for successful applications. We've kind of touched on a lot of different projects here. So we would love if you could do research, and if anything piqued your interest throughout this talk, you can go to rfs.sirweb.org and look at all of our projects. You've seen a lot of screenshots from the website in the previous slides, and then you can find those on the website. You can also look at those specific sites in the past and see if there's anything that you're interested in. Additionally, please provide succinct but high quality answers. Well, we do receive a lot of applications, and we really appreciate the ones I get that are very succinct and highlight your skills and previous leadership experiences. Please don't copy paste your CV into the application dialog box. It'd be great to emphasize any local or regional IR efforts you've been involved in, or any reserves efforts you've been involved in. Any formal type of symposia as well would be excellent and would improve your odds of higher consideration. Additionally, please provide tangible deliverables or skills that you think could align with current projects. So for example, if you have a portfolio for your art writing skills, that would be excellent, for example, for the education committee and their materials. The website you coded would be excellent for webmaster consideration, and for education PowerPoint for teaching, that would also be valuable for the education committee. Along those lines, highlighting relevant skill sets for the existing projects. So if you're a social media whiz or a medical illustrationist, prior symposia host or event coordinator, those are all very valuable traits. Those are just naming a few. I'm sure there's a lot of unique talents out there. We would love to have a variety in the Medical Student Council. And lastly, propose an innovative idea. So first, we would suggest looking at the existing projects and see what you can add to the existing projects in terms of expanding them. We would like there to be certain flagship projects for each committee that are continued and longitudinal across time, because then those are contents that we could update in the future and kind of have these growing documents that are more and more official every year. They get updated, as opposed to creating new projects every year that end up falling in the subsequent years. But if you do have an incredibly innovative idea that you just really would love to push, please include a project timeline, the resources you'd need to get that timeline completed, and the proposed endpoints and accomplishments that would result in doing this project. So we are very flexible. We want you to do something you absolutely are passionate about. And if there's nothing existing that you could see yourself working on, please submit an innovative idea. Here we've listed some successful applications, some examples. And in regards to these examples, we really are looking for people who can demonstrate that they're highly motivated thinkers and doers, people that can play on a team really well. We emphasize strong collaboration throughout the year, and people who can be clutch, for example, quote unquote clutch, who can come through and kind of get things done. Also people who are invested in collectively improving an organization. Really, we're adding value to an existing organization as opposed to just serving ourselves. So we would like to appeal to a higher group, a higher body, and that is the MSC collective. So attached here are some successful applicants, and they did a great job of highlighting discrete data points. So if you see connected 20+ students, weekly 2-hour office hours, and then on the right, they secured over $10,000 in funding. Detailing specific deliverables in a concise manner is really what we're looking for, and any previous experience in doing so. Again, here are some more examples that you can browse through. All right, and that's all we have. Thank you for attending the meeting and for staying with us. I know we went a little bit over time. And please visit and bookmark the RFS website at rfs.sirweb.org, where you will find all the resources and content that our committees generate. Additionally, if you do utilize any social media platforms, please follow and join us. We are really trying to push our content and projects through those platforms and any events and happenings through those means. And please feel free to contact us at sir.students@gmail.com or specifically reaching out to the individual committees. Thank you and have a great evening.